Hi everyone, we're now going to talk about preparation, so what we need to prepare to put a cannula in our patient. Obviously we have a tray. I'm thinking about our ANTT. We would...
Which we wash our hands.
Wash our hands.
Yes.
And we give the tray a good clean, starting from the inside and working our way around.
So this is just like the stuff that we did in the previous videos about exit non-touch technique. So this is where all this is relevant. Okay.
So we're obviously going to do this before we approach the patient. We're going to choose the appropriate size cannula. Okay. Then we're going to use a tourniquet. And I always take a couple of cannulas, so I don't have to leave and come back for any more. Some gauze. A syringe, a needle and a flush. And obviously I check that before I go there as well. A dressing. A 2% chlorhexidine wipe. And of course our needle-free extension.
So once we've collected all this equipment, we would then give our hands another clean, and then we would prepare it using an aseptic non-touch technique before we get to the patient, and then we would then start to approach our patient. Once we got to our patient, we would then need to follow all the things that we normally would do. So first of all, we'd introduce ourselves, say why we're there, say our role, and then get consent for the procedure. So I'd be like, hi, my name's Tom, I'm a nurse, and I'm here to place a cannula. Some of your patients will know exactly what a cannula is, and they'll just like stick out their arms and go on for it, that's no problem. Some people won't know what a cannula is, so you need to try and explain it in the simplest possible way. So I would always say, and I don't know about Tina, but I would always say I'm going to insert a flexible plastic tube into your vein. Some people say things like, I'm going to insert a little needle into you, but then that sort of in the patient's mind will think that there's a metal needle still in their arm, which isn't probably the best way of doing things. Once you've explained the procedure, they might say, like, does it hurt? Yeah. Things like that. And I wouldn't go crazy about that, I'll just say it's like a blood test. So hopefully they know what that means. And then once you've got that, you can then get consent for putting the cannula in. So sometimes, I don't know about you, Tina, but I ask them which arm they prefer.
Yeah, give a sense of power.
Yeah, give me a sense of control over the whole thing. But sometimes that doesn't work out because you have to just put it on the other side. So you can ask them that if you like. And then the important thing to ask them is that, is there any reason why you can't use that arm? And it's all the same things that we talked about when we did phlebotomy. So you can't put it in people's arms if they've got had breast cancer and they've had lymph node clearance. You can't put it on the affected side. You can't put it on the affected side of a patient who's got a arterial venous fistula, and you can't put it on the same side as someone who's had a hemiplegia, so like a weakness from a stroke, for all the various reasons we talked about. And there's all the obvious ones as well, like broken arms and pus arms and all that kind of stuff. You can't stick a needle through those. So once you've decided on your arm and you are happy with which side you're going to be doing it on, you need to get your patient in a comfortable position. So ideally they want their arm outstretched and supported on a pillow, and sometimes it's better to fold the pillow, place it underneath the elbow so it can be there. You might want it palm up or palm down, depending on where you're going to be putting your cannula, and so it needs to be very well supported. It's important to make sure your patient is comfortable, because if you don't make the patient comfortable and you do miss or don't get the cannula in, they're more likely to say, yes, by all means, have another go. But if they were really uncomfortable, they're more likely to say, no, thank you very much. Plus also they'll be more relaxed, so they'll be more amenable to having the cannula in. Alongside that as well, it's really important to make yourself comfortable. If you don't actually get yourself into a comfortable position, you're just setting yourself up to fail already. You'll never actually get the cannula in. You're less likely to get the cannula in if you aren't in a comfortable position yourself. So make sure the bed is raised, make sure the arm's out, make sure you can actually reach the person where you're going, you can reach the sharp spin, all those different things. It's really important to do, especially when you're first cannulating. Okay, so that's sort of preparing the intervention. Once you've done that, we're then going to start looking for some veins, and we'll talk about that in the next video.